Welcome back to Local Doctors on Call. In this segment, gentlemen, we're talking about adjunctive therapies for trauma, and I just want to know, what is moxibustion?
Well, moxibustion is the burning of a therapeutic herb on or near the surface of the skin. It's actually a member of the chrysanthemum family, and its botanical name is Artemisia vulgaris. Now, of all the herbs that are out there, the ones we know about and even the ones we don't, this is the only one that's ever been found to have a therapeutic value to the degree that it does. So by holding it near the skin and warming certain areas of the body, we can expel what we call cold syndromes in Oriental medicine. We can move healing blood, nutrient-rich blood and energy into the area, and we can actually alleviate pain.
Wow, so just from this one herb.
Yeah, it's pretty amazing. It burns at a temperature of 670 degrees, and what's cool about that is it never combusts, which is actually a very good thing if you think about it in a clinical setting. But it actually has the ability to warm. So let's say a person has pain in their joints and it's worsened by cold. By applying Moxa just near the surface of the skin, it's not unlike burning, it maybe looks like a cigar.
Okay.
Something
so it's
like
about that long? Or
they can be. Of course, they burn down like anything, but there's different methods of using it. But one of the most commonly used ones is just looks like I call it a big cigar, and we hold it near the skin and we move it around the painful areas. Patients love it. It really works, and it's been, again, it predates acupuncture.
Is it an instant relief, or do you kind of get better? Do you have to put it there for a while, or?
Yeah, it would have to be there for throughout a session. It may be there 5-10 minutes.
I see.
And you would have repeated sessions like anything. But in the case of, as we said, cold that is hindering the movement of a joint or causing pain, the relief can be almost immediate in some cases.
Very interesting. All right, so we've heard a lot about this with the Olympics going on. What is cupping therapy? Of course, Michael Phelps and even members of the U.S. men's gymnastics team, we've seen those welts or bruises on their backs in most cases. Tell us about this.
Well, cupping's been around for thousands of years, and it began, we understand, historically by using the horns of animals, which were a perfect vacuum.
Okay.
And so they would introduce a flame into the horn, place it on the skin, and in that period in history, they were using it more at the time for removing pus from a festering wound. And then they found other uses for it.
Right.
And today we see, as, thank you, Michael, and congratulations, by the way. But we see that the athletes are using it, as they have for centuries, to move blood that's not circulating. We call it ischemia, blood starvation in a muscle group.
Right.
So when anybody that works out or exercises or even has a trauma, as we mentioned earlier, has soreness and achy joints and muscles, we use cupping quite a bit to move blood.
And you brought a sample with you. I just want to show this.
We actually
is that
did.
A piece of that's exactly what you put on the skin, right?
It is. It's just a little glass jar. It looks a little, not unlike a little fish bowl, we might say. And there are different sizes. We would just call this a medium cup. But again, we take a flame, we introduce it, we place it on the body, and it can be used in a stationary fashion, or it can be actually moved. It draws the skin up. It's not uncomfortable. Patients love it, but one of the things that we notice is that athletes are using this. I might mention too, Tom Brady, everybody knows, the quarterback of the Patriots, actually is a part owner in an Oriental medical facility, and because he's such a believer in it. And so sports enthusiasts use this all day long, as you saw with Phelps. And I'm just going to throw this out there, but cupping, gold medal, cupping. I'm just saying, do the math, right?
And Dr. Fuller, you don't have to be an athlete to use cupping therapy, do you?
You don't, actually. Many patients come in and they go, oh, my back hurts a little bit. I went to bend and pick something up and I felt a little, twinge.
Yeah.
And then they'll come in and they'll receive acupuncture, and we do a little cupping at the end also. And it relieves all that stagnation or that blood that's kind of sat in there trying to heal.
And so with the capillaries, if that bruising takes place, that's cosmetic pretty much.
Well, that's actually a good thing, though. When we see, like as with Mr. Phelps, and we saw the dark circles, and kind of all of America goes, oh, what is it? It's actually, we look at that and go, great, that's a good result, because that blood that isn't moving moves up to the surface by way of suction. So in a way, when you think about massage, Grant, it's always kind of down and into the tissue. Cupping actually pulls up and away from the body. So it kind of gets blood that's not circulating kind of back into circulation. And if it's not, when it gets sludgy when it's not circulating. So this is one way to do that.
To pull it, to pull that skin up and get things moving. All right, well, don't go away. More local doctors on call in a moment. Welcome back to Local Doctors on Call. I'm joined by Dr. Wrench and Dr. Fuller. Gentlemen, we've been having a discussion talking about adjunctive therapies for trauma, and you were talking about cupping therapy, and there was a point that you were trying to make.
Yes, exactly, Grant. One thing I did want to mention, I know a lot of people actually can purchase cups and do them at home on their family members and themselves.
Yeah, right.
One thing just that we want to say that you would never cup over arteries or large vessels, and you would never cup over broken skin, and you would certainly advise so never cup on the abdomens or low backs of pregnant women. And when you buy these, they don't tell you that, so
right.
I'm telling you that.
Yeah,
okay.
just some of the risks
just
to
be on
avoid.
the safe side, yes.
Yes, from the expert. All right, so I want to ask, what is laser therapy? What is laser therapy?
Well, laser therapy's been around since the 60s, but really more as an adjunctive medical treatment since for about 20 years. And we use at the college, like a lot of clinics use, what's called cold laser, or LLLT. It's low-level laser therapy.
Okay.
It's called cold because it's athermal or non-heat producing. Now, in 1968, there was a guy named Andre Meister in Hungary that did laboratory testing with rice. That's half rat and half mice.
Yeah.
But and what he did was he implanted tumors in these rodents, and then he stitched them up, and his idea was to vaporize the tumor with the laser.
With the laser.
Well, the lasers hadn't developed to that degree yet, but what he did find out, while it wouldn't vaporize the tumor, what it did do was it caused the incision and the surgical closure of same to heal much faster. So what we now know today, that lasers not only are very therapeutic in that they amp up the body's metabolism of every cell. You have what's called a mitochondria.
Yeah.
It amps the cell's metabolism up. That speaks directly to the lymphatic, the central nervous, and the vascular system, which creates a healing environment in the area. The other thing that Meister found out, it aids with slow healing wounds and fractures up to 60%. So it's a wonderful addition to a therapeutic treatment.
All right, and so another treatment in these therapies, what is Tui Na?
So Tui Na is like the Chinese form of massage therapy, and it's a little different in the way that we use. It's not like going and getting a Swedish massage for relaxation. We use this more for healing and certain medical conditions, and included in this is bone setting, which isn't that much different from chiropractic care. Now, primarily, bone setting is used in China, right? And Tui Na we can use here, and we do quite a bit of that. And we press different acupuncture points, similar to shiatsu and that sort of thing. But it's used a lot to help loosen muscles or to help strengthen different areas that may have weakened.
We might mention too, when we say bone setting in this country, we're thinking about, I have a fracture, it needs to be put back into its proper place. Yeah. While they are experts in that field, when they say setting, they also mean, like a chiropractor, that as we move 206 bones around through a normal day, things get out of place. So setting in that realm is to simply make sure it's where it's supposed to be.
Make sure it's aligned.
And we're talking exclusive of fractures, although they can treat that too. So.
Okay, interesting. And don't go away. More Local Doctors on Call right after this.